Because of these joint efforts and collaborations, we've seen the reductions in HIV prevalence, as I've shared with you. We've seen the reductions in new infections, in AIDS-related deaths, in stigma and discrimination, especially in relation to people living with HIV. But we still have concerning statistics. For example, even with the reduction in new HIV infections, in 2024 alone, we saw 4,700 babies seroconverting, being born of HIV-positive mothers. And yet we know that this shouldn't happen because the means exist. Where do we stand in terms of the UNAIDS 95-95-95 targets? From our data of 2024, and we will soon analyze the data of the current year, but we will share that because that is ready around March of the following year. So that's why we are still using data of the previous year. We have to collect this data from the health facilities, go through it, synthesize it, work with the experts before we can share it with the public so that it is validated data. But from the data of 2024, Uganda is at 94 for the first 95. You know, the first 95 is people who have HIV testing and knowing their HIV status. So 94% of those who have HIV have tested and they know. The second 95, we are not doing very well. We are at 90. 90 can still be an A, depending on who the teacher is. So we are 90. It means that 90% of those who are HIV positive are enrolling on treatment. So we have, you know, a group of HIV positive individuals out there. They have tested. Many of them are adults, some are children. They are yet to make a decision to start on treatment. And then for the third 95, we are really doing well because 96% of those who enroll on treatment are taking their treatment well and they are achieving viral suppression.
Our friends from the media, you will remember that Uganda has committed to end AIDS as a public health threat by 2030. And we have to ensure that our strategies are resilient, they are inclusive, and adequately resourced to achieve long-term impact. As shared by the DG, Uganda has made commendable progress. The national HIV response has declined significantly, and new HIV infections have declined to 37,000 in 2024. However, one of the most urgent priorities is addressing high rates of new HIV infections among our young girls and young women. In 2024, here in Uganda, young women aged 15 to 24 accounted for 78% of new HIV infections among adolescents.